I'm delighted to have Nabeel with me. And Nabeel and I have been talking about a whole range of things. We made the connection through Cyber Somalia, who's already been on the podcast and works in an amazing company, Remitly, where I've had a number of the stars from that organization here. They're the little hive of leadership developers. And here's another man who loves leadership, with background in neuroscience and behavior from Columbia University, UBS, Barclays Capital, IPOs, AI, and now we're in the fascinating area of a software platform called Phamily. So welcome, Nabeel. Great having you here.
Thank you, Jonathan. Great to meet you and great to see you.
Yeah, well, look, there's so much we can talk about, and I think health is such a big thing. As you say, 9 billion people on the planet. Can we make a difference to their health and wellness? That's quite a mission. So tell us about what you're building and why you do what you do.
Sure. So I'm the founder of a company called Jaan Health, and we are best known for our AI-based care management platform called Phamily. And it's really the first platform to automate care for patients with chronic diseases. And what we really like to focus on is not just the idea of you're somebody struggling with diabetes, heart disease, asthma, etc., but how do we support you between visits to the office or clinic or hospital? And a big part of our view on the world is that too often healthcare is, we talk about it being episodic, we talk about it being reactionary. But the biggest thing I think we miss in the world of healthcare is that, especially if you have a chronic disease, which is where the vast majority, 86% of all healthcare spending is on chronic disease management.
How much, how much is on chronic?
86%.
Wow.
So in the U.S., right, just one of the statistics I love to talk about is, we talk about how healthcare is almost 20% of our GDP, for the biggest economy in the world. To put it in another way, spending on chronic diseases is nearly 16 plus percent, almost 17% of our GDP goes to chronic disease management.
That is, I mean, just staying with that figure, it's a phenomenal, shocking waste of money. I mean, it isn't for the people who've got it, but the
Sure.
point is that they're only lengthening their lives by weeks or days, or even not even lengthening their lives, making it slightly less unpleasant with a very expensive drug that might extend their life a little bit. But it's always normally it's this concept that their health span ends before their lifespan ends. And there's this almost like sometimes it's 10 years. I saw this with relations of mine who hadn't looked after their health, or they had heart disease, lung disease, Alzheimer's, cancer. But their life in that final stage was pretty miserable. Now, people often go, nothing to do with me, it's all the environment. But no, there's an awful lot we can do. And this is where I think what you're doing does excite me, which is why I think in inspiring leadership, while we're talking about leadership, it's about leadership to make a positive impact in the world. And that's what you're looking to do, Nabil.
Absolutely. And, I think if I piggyback off of this topic and, kind of your last couple points, one of the things I would stress here is, when we spend a lot of money and we think about chronic disease management, some of it is waste. But I would argue that a lot of it is the march towards what I call inevitability, and it's also one of the challenges of managing chronic diseases. They are effectively diseases of old age. The reality is that no matter how healthy you are as a young person, even into your middle ages, at a certain point, if you live long enough, you will develop some form of a chronic disease. Now, it doesn't need to be debilitating. To me, this is a core point of it. We don't need to have chronic diseases that turn into end-stage renal disease, right? The final stages of kidney diseases, or cardiovascular buildup and cardiovascular disease that builds up over time. Doesn't need to be uncontrolled hypertension or heart failure or a heart attack.
And just to clarify for my understanding, but
Sure.
also people listening, in layman's terms, what is a chronic disease? There's acute, there's chronic, there's disease. Now, what is the definition?
Yes, excellent question, and let me clarify this. So, for the average person who is not elderly, when you think about why you go see the doctor or why you would ever go to a hospital, it's typically for what I'll call it's for something like maybe you have broken a bone and you need to have surgery, or you have the flu, some kind of short duration type of ailment, or a one off that is a byproduct of some event that happens in your environment. Okay, simple things. You get treated once. You might go through a procedure or a short dosage of care, and then you come back to quote unquote normal. With a chronic disease, the definition is that these are diseases that are what I call diseases of like their lifetime conditions. Once you develop diabetes, effectively, you will live with diabetes for the remainder of your life. Once you advance it with chronic kidney disease, your body does not return back to its quote unquote, default status and
Yeah.
where you were when you were healthy. Now, the big difference with most chronic diseases versus some of these episodic diseases that I mentioned are primarily number one, not only is it you live with it for the rest of your life, but you can live for a long time. So this is not a case of, I could break my arm and I will wear a cast for maybe, 10 weeks. I have to go through some rehab, but 6 to 12 months later, I should be back to normal. With a chronic disease, I'm living with this for if I were to develop diabetes. I just turned 50 recently. I still have anywhere from, even if I have serious cases of diabetes, I probably still have anywhere from 20 to 30 years of lifetime ahead of me at least. Uh, these are conditions that you have to plan decades over, not weeks or months.
Yeah, that's really helpful. So these lifetime diseases that we're spending 86% in the UK on these lifetime diseases. And the way that you're trying to help out, just explain to us what your aim
Sure,
is, because you're ambitious in what you're aspiring
of
to do.
course. So let's use diabetes as an example because I think it's one of the most prevalent, probably the second most prevalent chronic disease on the planet after various forms of cardiovascular disease, most likely high blood pressure and high cholesterol. But diabetes is the one that I think many people understand as being a serious chronic disease, but a manageable one. And if you think about the typical diabetic patient, at a minimum, they are, and I'm thinking about the healthcare journey first as opposed to what they have to do afterwards, but they are getting a A1C, which is a quarterly blood test that you take that measures how your blood sugar has fluctuated over the previous 90 days. And that is used oftentimes to drive your treatment and the management of your diabetes. So every 3 months, you're going into a clinic or a hospital for this blood test. There's a doctor's office or doctor's appointment associated with that. You're going to get maybe a change to your medication or a change to sort of your next steps in follow up. And we call that healthcare. 4 times a year, this happens. It's expensive. It's intense in terms of it's far more frequent than the average person sees their physician. But then it stops. And the thing we never talk about is the fact that diabetes doesn't go on pause in between these A1Cs. It's not like the next 90 days are free and clear and you don't have to deal with any problems. A diabetic deals with healthcare every single day. They might be taking multiple doses of insulin on a daily basis. They may be taking metformin. They're certainly watching their diet. They're forced to watch their weight. There's a lot of other lifestyle and environmental issues that they're trying to manage around. It's most likely if you've got diabetes, there are other comorbidities, other types of diseases that you probably have that are associated with diabetes. Healthcare is an everyday journey for these patients. Yet, in the best cases, they're typically seeing their doctors or some kind of care professional every 3 months. And the reason for that is not that they don't need help every day, every week, every month, but we can't afford to provide that care. And so this is sort of the secret part of healthcare that we never talk about. And I'll start with the U.S. as an example. I mentioned that in the U.S. we spend almost $5 trillion a year on healthcare annually. Right? It's the highest degree of spending in the world. I won't even get into what the outcomes are for a moment, but we spend an incredible amount, and we're only spending more and more because the cost of healthcare goes up, and the percentage of the population that has serious acute types of healthcare demands is growing faster than the population that does not have serious healthcare needs. Uh, as a result, we live in a world where we can't afford the healthcare that we're spending on today. Yet, simultaneously, we're also in a world where there aren't enough healthcare services to support the people that we're trying to take care of. And the hidden secret that connects these two, because if you want to, is labor. And this is the part that's the real complication about healthcare right now. 60% of all healthcare spending in America is actually spent on labor. It's not drugs that make healthcare too expensive. It's not the surgeries and the devices within the stuff that we use in healthcare. It's the people associated with it. Unfortunately, healthcare is the least efficient, least automated industry in the world today. And the only other industry that compares in terms of spending is the hospitality sector. Now, there it's a feature, not a bug. You want someone to hand you a drink and a towel when you're lounging by a pool on vacation. But in healthcare, think about how many people are involved to take care of a patient's needs and how infrequent that care is.
Yeah, well, I mean, even in my own experience recently, I'm still waiting from a checkup I had done in September, and the specialist who saw me then and did all the scans and stuff back in September, and we're now, as we're recording this, we're in November. He probably won't be able to see me until March, and I'm going like, I'm left not knowing
Exactly.
what's going on for months. Where actually someone could quickly tell me at the time, here's the results, you're fine. Don't worry about it. Or we need to do some more work. Well, fine, I could cope with that, but let me know.
You're left in
Anyway,
limbo
yeah.
during all this time. John, if I can pull in which one quick thread there, because I think this is the most important part of all this. What you just described is actually the real issue and the problem that we're not sure how to wrap our heads around historically. I talked about how if we spend too much on healthcare, we can't afford it. Well, where's all the spending coming from? It's from the people who are doing the work. Okay, so if you want to cut spending, it's not going to come from marginal cuts to healthcare. It's going to come from reducing the number of people associated with healthcare. Well, guess what happens if you reduce the number of people associated with healthcare? Waiting until March or December for your results will seem like a dream because you're not going to get it till June of next year with fewer people. Well, if we want to solve the problem of why you're waiting so long for your healthcare needs, $5 trillion of healthcare spending, at least for the US, will seem like a dream when we're spending $15 billion, right? Or sorry, 15 trillion, not billion, excuse me. You can't solve one problem without exacerbating the other. The only way you tie those two together is through automation and efficiency gains. And to us, that is what AI is really designed to do.
Yeah, and it is a fascinating area. In Britain, you're talking to us from Seattle, having just flown over from New York. But in the UK, I think back 20 years, we were trying to do something exciting like connect all the National Health Service, surgeries and hospitals, so they could pass data around
Sure.
between them. And it was a car crash. It all cost millions and millions. No one got anywhere. No one connected with anybody else, and a lot of consultancies got bad mouthed and made a lot of money at the same time. So yeah, it is a problem. Now, on the Inspiring Leadership podcast, I'm always fascinated with leaders like you who were recommended to be on the podcast to me, that people find you inspiring. And then I go, well, I know part of the success of the 400 that I've had is that they've been recommended by other inspiring leaders. So for you, Nabeel, if you were going to shout out for two CEO level people that you've worked with, or they're running other businesses, or you collaborate with them, or whatever, that you'd like to publicly now acknowledge on this podcast, and that you think would make great guests recommended by you, who would you give a shout out for if you were to mention two people?
Oh, that's easy. I mean, there's a lot of people who I've admired and have shaped my career and my life in the past, but the first two who come to mind, I'll start with Emmanuel Conti, Manny Conti. He's a
How do I
CEO,
spell? How do I spell the name?
Emanuele, Emmanuel, and the last name is Conti, Conti. He goes by Manny, but Manny is the CEO of a fintech by the name of Numerix, Numerix. Uh, I would recommend him, and I think I would also recommend While technically not a CEO, he has been the leader of both local and state agencies. Dr. Omer Shah, he's a former Secretary of Health for the state of Washington. Just a human being who I have admired and I've known since childhood. And I've been lucky to know that he's uh, been the older brother I never had, but always wanted. And just somebody who I've looked up to all my life and continue to do so today.
Well, what lovely acknowledgement. So let's talk about Emmanuel Conti first.
Sure.
Um, what are the qualities that you respect about him as a leader? That why you think he should be on the podcast?
I'm gonna focus on two beyond just he's incredibly talented, intelligent, but there's two and just a great professional. I think there's two things that jump out to me, and I've had the pleasure. He was one of my first bosses back at my very first startup at Viant back in the late '90s. The two things that I've always admired about Manny are number one, his intellectual curiosity. We used to work on when we were both consultants. We both worked on a number of engagements together, and in particular, the way he would dive into all kinds of different types of business problems, and it was a level of curiosity that really taught me early on about how to attack not just a problem, but how to think about the world. And you can't just sort of come in with existing biases. Dig into the problem, understand it first, then develop a perspective and a point of view, and then look for more data to either further refine it or to come to a final conclusion. And his level of intellectual curiosity is one of the just absolute best I've ever seen of anybody I've ever worked with, number one. And then number two, and this is a part I greatly admire, especially when I was a junior analyst and just coming up in the world, his willingness to lead by example. Just it's one of the most valuable lessons that I carry with me to this day, especially as a startup founder. Um, he was one of the rare people I worked with who would actually teach, and he saw within me, I think, talent that needed refinement, that needed some structure, that needed some frameworks on how to look at the world. And his willingness to teach to get the most value out of me, which would help bring the most value to our organization, is something. It's a lesson that I've tried to embody now and carry with me all my life. So grateful to Manny for everything he taught me and the different ways he supported me throughout my career.
That's so lovely, and thank you for that acknowledgement of Manny Conti. And then Dr. Shah, tell us about how do I spell his first name? Spell his first name.
Umair, Umair.
Umair. Okay, so tell us about Umair.
Yeah. So in life, fantastic physician, amazing civil servant and public health leader. But in particular, when I think of Umair and what I admire most about him, it has to do with his ability to lead through a crisis. And in so many ways, between his personal journey and the career that he's sought out, he's a man who lives in crisis all the time. He's had incredible challenges in his personal life around family health issues and complications that would make the strongest of us wilt. Yet he has shown a resilience, a just a level of performance and leadership that always keeps me in awe from childhood to today. And his ability to manage through some of the biggest crises in the world of public health that we've had. For Dr. Shah in particular, I think he made his name with the first Ebola scare that we had in the mid 2000s in the U.S. When the first time we had Ebola patients come into the country, he was on the ground helping lead some of the efforts in Texas around managing that outbreak. And then obviously, I think what happened with Hurricane Katrina and the public health disaster that resulted out of that, he was front and center for the leadership of that, as many of the victims of the hurricane were relocated from New Orleans to Houston, which is where he used to be. And then, his first week on the job as a Secretary of Health here in Washington, was dealing with COVID vaccines and the distribution and administration of those. And obviously, the last 4 years have just been a nightmare in the world of public health. Uh, but I couldn't think of anybody better to lead our state in through those challenges. And one thing in particular about him, while he's been able to step up every time there's been a crisis and every time there's been some kind of challenge that requires real leadership, what separates him from anyone else I've ever met is the joy that he brings in those moments, because they are serious, scary at times events. But his ability to be joyful, his ability to understand that life goes on, that life needs to be worth living, is something that I deeply admire, because we're oftentimes working, even for what we do here. I think a reminder he gives me always is that, yes, we're working on really serious problems and we need to be serious people, but it doesn't mean we can't smile, right? We can't find happiness in life. We can't lead by inspiration as opposed to by fear. And so,
Yeah,
absolutely,
I love it.
Dr. Shaw.
Well, definitely after this, please drop them notes and invite them as your guests. Um, I'm always interested in people's origin stories. I think it's, how does a leader like you become successful, but where has it come from, and what has been the highs and the lows of those journeys? Because nothing is a straight line.
So
Uh,
true.
even a diversion is actually the journey. You just don't know it's the journey. It's a diversion, and you think it's a failure, but actually, it becomes your journey. It becomes your dharma, doesn't it? If we were to use that term. Um, so, take us through. Take perhaps 5 minutes on this. Your origin story, the things that have gone on for you that have brought you to being the leader of, CEO and founder of Phamily, and your Jaan Health as well. Just tell us your story.
Sure, sure. I like to describe myself as Midwestern. So while I'm of Pakistani origin, I am very, very American, Midwestern raised, born in New York, but Midwestern raised in Ohio, educated on the East Coast, where I did a lot of my professional life, and now I live on the West Coast. So for me, my origin story really reflects all the various parts and aspects of America. I've lived in, I think, 10 different cities throughout the country, and been shaped by my experiences everywhere, whether it's the Deep South, living in Atlanta for a little while, Pacific Northwest, where I'm at right now, and almost everything in between. My journey is, for me, in many ways, it's the classic immigrant's journey. Met that sort of cross sectioned with, I joke I'm a little bit of Forrest Gump. I've been in the right place at the right time in so many parts of my life in terms of just evolutions of how technology has changed our lives from when I was born, uh, having the opportunity to work in Wall Street, work in Silicon Valley, um, being in the middle of healthcare, kind of some of the major drivers of innovation and change, both not only in the U.S. but around the world. Um, but if I take it back from that high level to what's been my journey, I like to think of it as a journey of again intellectual curiosity. Especially, for another shout out back to Manny. I've been in a lot of different scenarios and situations where I've learned a lot from, and I've built this journey that, if you look at it on paper at a very high level, seems to be haphazard, maybe even nonsensical, right? I went to college to be a doctor, studying neuroscience, and in between, I developed a passion for the very early days of the consumer internet, developed some of the first websites on the internet, and then decided to become a software developer uh, instead of going to med school. Did that for a couple of years, and then realized, you know what, I like this. I now want to go into go work on Wall Street and be a financier in the world of healthcare. And now I run a AI company, pure play in the world of healthcare and healthcare services. Again, it's while none of these things seem like a natural outflow from the other, if you understand the vision and the dots that connect, it makes sense, because all of my previous experiences, while they seem unrelated, have been perfect springboards for me to do what I wanted to do next. Um, Professionally, that's how I think about the world. On a personal level, kind of underlying all of that, I often think back to the experience I've had with my family, who still lives in Ohio, friends I've made around the US and around the world, and the professional relationships I've had. And it's always reminded me about the importance of our personal networks and how they shape you, both in terms of who you are as a person, the values you hold, as well as the biases that you walk into throughout the world, right? I had to, I think about, I joke I'm very American, very Midwestern in my thinking in a lot of ways. And one of the things that, again, in my crazy journey of random dots that look like a scatter plot, I got to spend a year living in the UK, in London, back in 2000, and a fantastic experience that shaped my thinking for the rest of my life uh, was going to London and seeing what the experience was like, where I was a part of a hidden minority and a hidden quote unquote model minority living in the US, to moving to the UK, where arguably Asians are sort of the second largest ethnic group in the country. And their experience is actually quite similar in certain ways to the African American experience. I want to obviously point out minus the slavery, which is a huge difference in terms of the U.S. versus the U.K. But it was a very eye-opening experience for me in terms of being a part of society, yet not being a part of society at the same time. And as an American, who every time I open my mouth, people are like, "Oh, you're not from here." I kind of was in this in-between spot where people looked at me and judged me in one way, but the minute I opened my mouth, I was put into a very different box. And so that was very eye-opening for me in terms of understanding not just sort of the politics of the world, but understanding different experiences for other ethnic groups and minorities around the world.
So, was your experience in the UK a really bad experience, or was it
It was
mixed?
it was actually a fantastic experience in terms of the people I knew and met. I lived this interesting life where in the professional circles that I operated in, it was fantastic. I had a chance to work for UMG, Universal Music Group, for the primary part of that time. Helped open up our London office, so my experiences there were fantastic. Um, but it was because I was dealing with people who saw me as an American, where it was eye opening for me and something that gave me a different impression of, at least especially for America's history, like the African American experience. It was the first time where I had trouble getting a taxi cab at night, or when I
Okay.
walked into a store. Oftentimes, people looked at me very differently than any way I'd been looked at in Ohio or New York, etc. Again, and I got to understand something very different about the socioeconomics of Asians in the UK versus the socioeconomics of South Asians in the United States, and again, um, the relative impression that the general populace has. And so again, just it was an eye opening experience in terms of understanding uh, how different parts of the world are, right, and how different minorities see the world.
Yeah, and I think back to my schooling up in Yorkshire, and I was in a town called Halifax, which had a large Pakistani population, immigrant population, and my best mate was Mohammed. He was Pakistani,
Sure.
but I was considered to be the oddball because, like, why are you friends with a Paki? I
Yeah.
mean, literally, they were calling, which was a term of derision,
Sure.
because what had happened was, in some ways, the mills, which were in Yorkshire, needed workers to work there. So they had actually brought part of the population from Pakistan, which were quite poor,
Yep.
quite low socioeconomic group, to essentially work for very low wages in the mills. But then the mills all closed, and so what happened to their future and things like that. But for me, and when you read my book, The CEO's Compass, you'll see with my mother upbringing, we just accepted people for who they were. No, but I saw an awful lot of racism, and then when I was at the Royal Military Academy Sandhurst, I became friends with Himalaya Tapa from Nepal and Errol from Jamaica and Jeffrey Bostick from Barbados and Anwar from Jordan. And that was great. We were all good friends. We've stayed in touch for 45 years. And we're meeting at a reunion. And I've just been to Nepal to stay with General Himalaya Tapa. And my best friend Errol, we got married in Jamaica. So that was normal. But yet there were many others who was like, not sure about this. They're different from us, the other, which of
Sure.
course now you're seeing in American politics is really being polarized so much about the other and ICE and all that kind of stuff. We don't want to go on that topic, but it's just so sad to see how badly it's going. Anyway, on to your story. Carry on with the story because it's also what about the impact of chronic diseases that you've seen in family and things like that, and how that's given you quite a
Yeah,
calling to do something about
yeah.
this.
So it's always interesting. I think you grow up as a young person, even into your early middle age. For the most part, if you take even a slight bit of care for yourself, you're relatively healthy. And when you're young, you don't even have to take care of yourself, and you're relatively healthy. And the issues that pop up, you bounce back from because you feel indestructible. And your parents are still relatively young, and don't they haven't experienced maybe going through the beginnings of chronic disease development and manifestation, but they're relatively healthy. I think once your parents start to get closer to sort of their senior years, and they are much more likely to develop these chronic diseases, you have a greater appreciation for what those challenges are. And my experience was no different. And in particular, it involved my father. About 10 years ago, a little over 10 years ago now, my dad suffered a pair of heart attacks. Now,
Oh
luckily,
dear.
luckily for our family, he survived. But what's interesting about that moment is that if you think about my father pre-heart attack, and if you had met John, if you had met my dad, call it 12, 15 years ago, you would have met a mid-60s South Asian male, uh, so already predisposed to genetic risk factors for cardiovascular disease. He was overweight, didn't exercise, had a poor diet, and lots of stress in his life.
And living in America?
Living in America, yes. And so it wasn't a matter of if he'd have a heart attack, but when. And part of the challenge was that if you talk to his physicians and his care team back in those days and ask, and I've done this, how do we take care of my dad? What do we do for him? Um, One of the key pieces of advice they'd always give was, well, if he ever has chest pains, rush him to the hospital. And it used to frustrate me to no end. Like, I don't. That's not the advice I'm looking for. That's not the support I need. I don't want to call you from the ER to say my dad has died. We're trying to keep him out of there. What do we do? And the challenge was that for me, I have one father, and he means the world to me. But his physician, who is a good human being, has 2,000 patients in their panel. Even if he wanted to help my father more frequently, he just didn't have the time nor the resources, let alone the incentives or the you know system to be able to do this kind of work. And so for my dad, what's interesting is that we had that moment where we had to call and notify his physician. Dad just had a heart attack. Just letting you know. Now, luckily, he survived. But what's interesting to me is that on discharge, and for years, the 10+ years since then, his care has changed dramatically and drastically. Now he literally has his cardiologist's cell phone number. He has a pair of nurses who are checking in with him on a bi-monthly basis, making sure that he's doing okay, checking on any issues or symptoms or other types of follow-up. His insurance company has created um, incentives for, like, okay, it subsidizes gym membership. There's incentives for healthy eating habits, etc., to support him. And so we spent all kinds of time, labor, and money trying to put the genie back in the bottle, as if my father can go back to who he was pre-heart attack. Unfortunately, it's just not going to happen. But the way the system looks at my dad now is that suddenly he is worthy of care. Whereas before, because he had not had a heart attack, he was not worthy of care. And this comes from this mistaken, it's an accurate in fact, but a mistaken belief that the sickest 1% of patients, they represent 15 to 20% of all healthcare spending. That's a fact. That is the truth. But where the belief is, or that fact is misconstrued, is we act as if we spend all our time on those people, we'll make a difference in terms of healthcare spending and outcomes. Once you hit the sickest 1%, it's too late. If you've hit end stage renal disease, you're not going back to normal. When you have uncontrolled diabetes, it's not going back to normal. Once you've had a heart attack or heart failure, you can't go back to a normal life. It's very expensive to deal with those patients. What we conveniently forget is arguably the sickest 35 to 40% of patients, or what I call one bad day away from falling into that 1% bucket. My father, perfect, according to the system, perfectly fine the day before his heart attack. The day after his heart attack, he's now a healthcare problem that we need to deal with and manage. His heart attack was not a binary, like it was not the equivalent of a car crash, that just an accident that happened. It was built up over time. There were a lot of things and a lot of warning signs ahead of time that the system just didn't care about or couldn't deal with. That's the problem in healthcare today. My father is not some isolated example. He is one of almost 100 million people in the US suffering with multiple chronic diseases, and arguably billions around the world. Those are the people we need to support and help. It's not after it's too late.
Yeah, I think that's a really powerful story. And thinking of stories that you could share, what about darkest moment in your life and what it taught you? What would you pick as a
Wow.
dark moment for you?
Um, I think this is the moment where typically, somebody will talk about a professional setback or something else. But, I like to be an open book on a lot of these things. And I think for me personally, the darkest moment in my life was about 12 years ago. My wife and I were trying to start a family, and we were having a lot of trouble in that moment. And we finally had gotten pregnant, and were expecting a baby, and unfortunately, during the second trimester, lost the baby, and that was a really tough moment because after so much effort, hard work, preparation, doing all the right things, etc. Um, you know, we had the worst possible outcome out of it. And beyond the emotional crushing part, I think it was something that it reminded me of a lesson that I'd learned in various ways throughout my life, but just really, you can do all the right things in life. You can put in all the effort, do everything, yet the outcomes sometimes don't come out the way you want. And um, that lesson has stuck with me forever, that we did all the right things. We were trying to eat healthy, be healthy, do everything we needed to do. You know, whether you want to call it fate, God, whatever, life had different plans for us at that moment. And it led to that dark moment, wound up not, I'll put a nice positive spin on this, wound up leading to also the happiest moment of my life. Uh, it led to two the happiest moments of my life. One, it kind of led me to really start this company, because I think at that point my wife and I decided, okay, well, we're probably not going to be able to have a family. We've gone through too many of these things. It's just not on the cards for us, and so we decided, okay, we're going to dedicate our lives to uh, more interesting things. I wanted to see, how do I sort of solve healthcare for the world. My wife wanted to go down a different path, and we were going to dedicate our lives to our professional world and our families, and the like. And in the inverse of, you can do all the right things and plan everything, and sometimes outcomes don't work. You can not plan for things, and life magically finds a way. And our beautiful daughter, who's now 10, uh, I don't want to call her a mistake, because if she is the greatest mistake in the history of mankind. We had her naturally. She was born almost 6 months after I'd started I'd left Wall Street, quit my job, uh, and basically burn all my bridges to focus on what we're doing, and so I couldn't turn back. We get the amazing news that we're pregnant, and it really changes your life. Where, oh my God, this was not in the plans. I was not planning for that. I did not want this to happen in one sense, and now it's here. Time to kind of reschedule and rethink our lives going forward. But just an amazing experience. But that darkness led to the greatest light I've ever had in my life.
Yeah, and thank you for sharing such a tough one. But as you say, you just don't know what the plan is that the God, the universe, call it what you want, has. And I think it was John Lennon who said, like, uh, life is what happens when you're making other plans. And
So
you
so
had
well
life
said.
happen. Yeah, and so the other thing I'd be interested in your sharing a story. Imagine you going back to when you were a young man, age 16 to 18. and back you've gone, here you are 50 and you're going back to see yourself. What advice would you give to your younger self? This is important, but this is not. What would you say to the
Wow.
young Nabeel?
Yeah. Gosh, there's so many things I would say to the young version of myself. I would, I think, on a serious note, I would tell the young version of myself, um, what you think is important and what you think is serious, and the most important things in your life today are going to be the things you laugh about a couple of decades later. The stresses that you think about this. Oh, I struggled on this test. I asked a girl out and she wasn't interested. Um, you know, will I get into this college? Right. And similarly, the accomplishments that you think are the biggest deals in your life at the age of 16, I don't even remember any of them, to be honest, at this point in my life. And so I think that's the first thing, that, live a life of purpose. Do not live the life of the moment. Have your, I think it's like, have a plan, have goals of where you want to be, and understand, these are all steps on the way to that goal and to that life that you want to live. They're not the end and the final part. I think
Yeah,
secondly, I would advise the young version of me. This is a little bit facetious, but if you growing up in Cincinnati, buy lots of real estate in this on this farmland called Mason, Ohio, that nobody ever wants to go to, because 30 years later, it's going to be the most valuable real estate in the state. But
yeah. There's always part of me wish I could have gone back, knowing what I know now about
Sure,
history or investment decisions. Let's go. We've just got about 15 minutes. Let's go through the round inspiring leadership compass, beginning with moral quotient, the sort of true north. Um, when you've let your values slip, what is your advice to other people about how to get back on track? When because it'll happen to us all. I know it's happened to me. But what is your advice about getting back on track
sure.
when you let your values slip?
I think the most important way and thing in terms of if you ever are faced with that situation of how do you get your values back on track, is before you even enter that situation, you have to make sure you surround yourself with people who share your values, because that is, if you have people that share moral compass, that is the easiest way to get back on track. Because once you go down a dark path, it's very difficult for any one individual to get out of it, to backtrack and do a 180 on their own. But when you have people like for me, I made the best decision of my life was I married the most amazing woman 18 years ago,
You
and
did.
I did, yes, thank you, and you know her well, Jonathan.
Yeah.
It is the single best decision, the single luckiest thing in my life. What's great for me is that if I ever go against my values, who I am, first and foremost, I've got her to pull me out of mistakes I make or going down the wrong path. In addition, I'm so grateful and lucky that I have these amazing parents who have taught and instilled values within me. Who, I'm the child of immigrants, so tough parents in certain ways, but the beauty is that they're very values driven. And for my mom, she does whatever accomplishments I've had in my life, none of them impress her, none of them mean anything to her if I'm not the person that she raised and she wants me to be. And so it is such a refreshing thing that if I tell my mom, oh, we did this, when I was working on Wall Street, had this big deal go through, um, you know, did a $10 billion IPO. Okay, well, great. What does that mean for the world? You know, who cares?
Yeah.
What are you gonna do? Or I got a big bonus. Fantastic. There's this charity I read about recently. They could use some support. It's fantastic to have somebody who can pull you back to what really means things in life, right? So I've been lucky with
You,
that. And then friends.
your mother and I would get on well. Your mother and my mother would,
Oh,
who's now dead,
fantastic.
would get on well. I had that. I'd tell her of what I thought were amazing achievements. She'd say, yes, dear. And what did you have for supper? And what are you doing for the local charity? Yeah, that's so
100%.
good. Thank you for that. Purpose quotient, PQ, is the next one round.
Sure.
You've clearly got a clear sense of meaning and purpose in your life. So I don't even need to recover that. I think it's just beautifully done. But when you have people who you're supporting, helping, advising, who have not found their life meaning and purpose, how do they find it? How do you help them find it when they've lost their way? Or they've been laid off because AI has replaced them and they're not needed anymore, you know?
Yeah, it's an interesting question. I think one of the first things I try to do if I'm trying to help somebody or support them through that moment, and I'll start with that angle because I think one of the biggest things when you're trying to support, guide, advise somebody, is we are not transparent about our flaws as human beings. And one of the things I really believe in is, while I've been blessed to have had many successes in my life, I've also had some serious failures. Life is not a straight line up to the top for almost anybody. And in fact, I at this point in my life now, I have a sixth sense of, if your life has been a straight line of just success after success after success, I actually don't trust you, because until you've had serious setback, some serious failures, you really don't know what resilience looks like, and you will face those moments in your life where you need to have resilience. So when I am working with somebody or talking to somebody who they've been laid off or they've gone through some kind of professional setback, personal setback, etc., I try to be very transparent. I tell people I have been laid off or fired multiple times in my career. I have been on the wrong end of a internal political battle on occasion that has caused my career to go sideways or even take a step back. And I understand what these things are, but I'm also a big believer in just being the eternal optimist. Life can and will get better. It's the only reason why we should move forward in life. Otherwise, what's the point? What's the meaning of these things? And I take enough. There's enough signs and signals in the world of that better day to come, and I think it's important to remember that. But you can't just say it because you've experienced better days and you tell people that. It's because I've been through, for at least for me, what I call the pits of hell, and I managed to climb out. Not by myself. There were wonderful people who helped pull me out of those holes, but I made it. I made it out, and I kept climbing up and kept going up the mountain, whatever metaphor you want to use. But that's been my perspective.
Yeah, no, really love. I love that attitude. Really like it. Health quotient, third one round. Mental, physical health and well-being. Obviously, a key topic for you and I. Um, how do you keep yourself physically and mentally healthy? And you'd recommend it to others. So there may be bits you do that are good, and you may be honest enough, which I know you will be, to tell us the bits you know you should be doing, but you're not doing it.
Yeah, it's a challenge, and I'll tell you the following. I think for me, the biggest challenges that I face at this stage in my life is it's a I'm so blessed that I work on something that has so much meaning to me, not only on a individual level, but I think in terms of what I'm trying to do for the world, hopefully. And so I get excited about the work I do. I've thrown myself into my career. This is the last thing I ever want to do. I want the second paragraph of my obituary to be about the work we're doing at Jaan and how we're helping people. Obviously, the first paragraph I tell people should always be loving father, son, husband, brother. Uh, but I want the second paragraph to be about the work that we're doing here and how we've impacted the world. So naturally, I like to work late. Sleep is always an issue. Um, Health, exercise, etc. These are all things that you choose to sacrifice because, well, there's always somebody who needs your support, needs your help, and every minute you take away from this mission is time taken away from others. But if you and coming back to surrounding yourself with people who know you, you trust, who share your values. I'm married to a beautiful woman inside and out who is the first to remind me, if you don't sleep properly, you will not have the mental health, stamina, and the energy to follow through on your mission. If you don't take time out to exercise, you will not have the stamina or the lifespan to do the things that you need to do. So it's important that you have people who remind you and will tell you, Nabeel, you're getting fat, or you're clearly not exercising or doing the right things. You're not eating well, not because of the aesthetics necessarily, but because you're not the best version of yourself. So having people who can be honest with you, and I'm married to somebody who is very honest with me, and I'm grateful for that.
Yeah. And Bill, this resonates with many of the leaders that I coach and work with and their teams. that their passion for what they do become workaholics. And everything in life is possible if you're prepared to pay the price and live with the consequences. But the price and the consequences are sometimes too high.
Sure.
And but in the obsession, and you have to be obsessed to be a founder and a CEO of a startup. However, you do need to have a wake up, smell the coffee moment. And as you say, an hour more sleep gives you 30% performance in your job. Well, not much else can give you that kind of increase. And, keeping fit and healthy. And I train 4 times a week in the gym. But all these kind of things are really important to us. People know it, but do they have the discipline to do it? And so that's interesting. Okay, um, we have got a little bit of time left. We're going to the top tip, which I'd like you to introduce at the very end. But we could talk about EQ, we could talk about resilience, we could talk about brand, or we could talk about legacy, or getting on with what I call CQ, collaborative intelligence, getting on with people who are very different from you. Which one would you pick if you're going to pick one to talk about?
Oh wow, those are all great topics. Gosh, I love them all. I'm ready to talk. I'm ready to give you another hour and
Oh, talk about EQ then. Let's talk about
perfect.
EQ. Um, how do you listen? How do you advise people to listen well to other people?
This is a great question because I will caveat this by saying it's tough. It's something I still continue to have to work on. The challenge of being energetic and trying to be creative is that you have a lot of energy and ideas inside of you that you want to share. But the irony is that you can't learn when you're speaking. And the only way you really learn is by pausing and listening. And that new information is what shapes you, gathers you, makes your own ideas, your own thoughts clearer, more focused, frankly, better. Having a child has really been had a huge impact in my ability to be a better listener. It's something that I think I struggled with earlier on in my career because you see it with a child where one, just the nature of children and their energy, their excitement, it can be tough to listen or for them to listen, and having to try to set an example for my daughter. How do we become better listeners? Well, if I'm not a good listener, you know, uh, she's going to learn from watching and observing me. So I think that's one piece of it. Number two, what's always interesting to me is what you learn from. Again, children have very different viewpoints and ways of seeing the world as compared to adults. And sometimes it's nonsense, but there's some amazing nuggets of wisdom or just new insights that you get from their perspectives. And it's just a reminder that even if you're talking to somebody who you think may not be an expert on a given topic or may not have enough of the life experiences that you're looking for out of somebody whose wisdom you seek, there's beautiful nuggets of information and gold in everybody. And if you make the effort to find it, it's there.
Yeah, no, nicely put. And so I'll pick another one out for you, and that's brand quotient,
Okay.
your reputation, your image, your impact. But this is what people say about you, Nabeel, when you're not in the room. So, knowing with your background at BA in neuroscience and behavior, when was the last time you had a really thorough 360 by an independent person on you as CEO?
So I've never had, I think the closest thing I would say would be my co founder and I. We try to do these at least once a year. Um, they're they're different from like I would say a 360. We try to do effectively an evaluation of what works or what's working, what's not working, uh, what are each of us responsible for in terms of the stuff that's working, like what are we driving and doing a good job of, and let's do more of it. What's not working, and what we have to take responsibility for. And I think we do that. We're not. I'll say this: we're not the best at doing it formally. I think it's something we're trying to get better at. But uh, I've mentioned or alluded to this theme several times. I think throughout, so I'm going to come back to it again. Surround yourself with people you trust, people you respect, and people who will be honest with you. Whether it's discussions about my wife, helping guide me through my personal health journeys, talking about my mom and keeping me on my toes when it comes to my values. My co-founder is a close friend from college who I've known for over 20 years. And, when I started this company, he was my the number one pick, in fact, of who I wanted to start a company with. And in my mind, if he was not on board, I wasn't going to start it. But part of it was not just because of his skill set. I think he's the best engineer I've ever worked with, the most commercial engineer I've ever worked with. But it's that his values align with mine, one. And number two, there's an honesty that we have with each other where we can have difficult conversations and difficult thoughts, and know that it comes from a place of goodness. When he tells me, Nabeel, hey, you're not the best version of yourself today, it's not because he's trying to push me out of the job or trying to, we're not having some sort of political turf battle. It's because he cares about me. I just say like, he loves me. He wants to see the best version of me because it's both good for me, his close friend, and obviously good for him and us as an organization, and vice versa. So, I'm blessed and lucky that I have a co-founder who I can go to for that kind of honest, frank feedback that I respect and appreciate. And then again, I'll throw yet another shout out to my wife. I'm really lucky to be married to somebody where I would be delighted if she was on my board, because that would be a big get. Again, if we were not married, she would be the ultimate get for my board. She would be the ultimate counsel advisor for me as a founder and CEO. And I get the beauty of not having to pay her and getting to be married to her and having 24-hour access whenever I need her. So
I really relate to that, having met your wife and worked with her. And also, I have a wife like that too. So I'm very, very fortunate. So we're at the final bit, which is the top tip. In a moment, I'd love you to say who you are,
sure.
what you do, a bit about what you've done in the past, and leave us with a top practical leadership tip that we could, in any country around the world, we could make use of that tip as approach to being a better leader. So over to you.
All right. Hi, I'm Nabeel Kaukab. I'm the founder and CEO of Jaan Health. We are the company behind Phamily, the first AI to manage patients with chronic diseases between office visits. And, my leadership tip is one around culture. Most CEOs and leaders believe that culture is everything and you want a great culture. But they also believe that cultures can be built. And I'm going to go with the perspective that culture is not something you can build or teach as much as one you select. You can teach knowledge, you can teach skills, and even beliefs, but you can't teach values to adults. And to me, culture is something that naturally emanates from the values that you select when you hire people, when you bring them onto your team, and when you promote people. If you promote people who are focused on mission, focused on ambition, focused on teamwork, you will have an organization and a culture that values and prioritizes teamwork and mission. If you focus on people or you select people whose core values are the self, are economics, are personal gain or power, you'll have an organization where it is every man or woman for themselves. Um, you know, there's a famous Herb Keller quote: "Culture is what happens when people aren't, or the values and the behaviors that are demonstrated when people aren't looking." Um, I love that. I love that quote, but I take it a step earlier. Culture to me is a byproduct of who you interview for and who you promote, and the values that they hold, because those values are going to carry through no matter what job they have, no matter what type of role they're in, or what background they've got. If you're a good person and you're a person who believes in teamwork and mission, whether you are working for a not-for-profit or you're working on Wall Street, your values will carry through.
Yeah. No, great top tip. I love it, and I've seen that actually happen in actual fact. So, Nabeel, thank you very much for being on the Inspiring Leadership podcast. Good luck with your business and making a difference to the world of health and how we get that kind of support. So we are dealing with these chronic diseases. I've really enjoyed our conversation. Thank you.
Jonathan, thank you. It was my pleasure, and look forward to hopefully someday speaking with you again. Take care.